I have a startling statistic for you. Did you know that chances are, if you're over 50 years old, you have about a 50-50 chance of getting a nodule on your thyroid? What? I know. I was shocked too. I just learned that from Dr. Richard Harding. He is an endocrine surgeon with Thyroid Nodule Treatment Center. You've already taught me a lot, Dr. Harding. First of all, thank you for having us here. This is Nicole, one of your patients. Let's talk about this stat. What, 50%? Who gets a nodule and why?
So a lot of people get nodules. You can get them even at a young age in 20s and 30s, but usually by the time you're 50, you have a 50% chance of having a nodule.
That you like see, feel?
Not necessarily. They can start off small, but then in some patients they tend to grow quite large.
Really? Why do we get nodules?
I can't say we know the answer for that. We just know that they're very common.
Okay, all right. That's scary, but here's the deal. Up until recently, you had to have surgery, right, in order to remove a nodule. You're doing a treatment now that I would say it's been around a long time, except for here in the United States, but this is something pretty revolutionary. How do you treat it differently than through surgery, which some people do have to do surgery, right?
That's correct.
But here's an option.
So I've been doing surgery for thyroid surgery for 28 years. And I was looking for an alternative, particularly for benign disease, where we know it's not going to be harmful for the patient.
Okay.
And so we learned, or I intentionally went to learn a ultrasound guided technique where you put a probe in the nodule and you can heat it up and you can destroy the nodule with the heat and then help the nodule disappear.
Wow, that's amazing, because you're trying to keep the integrity of the thyroid at the same time, right?
That's right.
Okay, super important. Nicole, I just want to talk about you for just a second, because you lived with a nodule for 8 years.
Yes.
What was it tell me, what was the feeling like? I mean, it grew over time, but what was happening?
Yeah, it started off small and it gradually got bigger to the point where it affected my swallowing. If I turned my head a certain way, it cut into my trachea. Kind of made it difficult to breathe, kind of a choking sensation.
Oh my goodness, that's scary.
Kind of made me cough once in a while, if it hit the right spot.
Right. And you could see it.
And I could see it. That was probably the worst part.
Yeah. Is Nicole typical? A lot of people just learn to live with it. We were talking about that earlier.
It's funny because when I started doing this, I thought that it would be a lot of young women who would have an irritating nodule, but then I had a lot of patients who've had them for decades that just did not want surgery, and then when this alternative came about, they came out of the woodworks to have it treated.
Wow, wow. So I know you did consider surgery, right?
Yes, it was recommended, and I chose to avoid it. I wanted to look at all the other options before and I was just about to go for surgery when I discovered this. Which I was very grateful for, yes.
This angel here for you, right?
So
tell me, you do the office, or the procedure right here in the office, right?
Correct.
So tell me, you came in, had it done. What was it like afterwards? Because the results were immediate. Tell me what you felt and saw afterwards.
It was amazing. It was like you could see the result, and then just from the swallowing and turning my head and not feeling like I was choking. Yeah, amazing.
You were like, oh, this is how it's supposed to be.
Yes, I had forgotten what normal was.
Right. I'm sure that's pretty typical, isn't it, Dr. Harding?
It's common to hear this, and usually within a month or sometimes within a couple of weeks, they notice this.
When people come in to see you, anybody watching today, this is really about education. So important to know there's an alternative out there. Are you able to determine when somebody comes in to see you whether or not they're a good candidate for this non-invasive or less invasive treatment?
Right. So first of all, they should have symptoms or a nodule which is growing, and then we need to make sure that it is not cancer.
Okay.
And so if we know it's not cancer, we know we can treat it with this modality.
Right here in the office.
Right here.
Okay.
That's right.
And I'm glad you're doing so much better. And here's a special offer that he has for you. When you book your appointment, just mention Sonoran Living. You'll receive a complimentary neck ultrasound exam. That's a $350 value. Thyroid Nodule Treatment Center is located at 2320 North 3rd Street in Phoenix. Call 602-889-2923. Visit the website thyroidnoduletreatment.center.